Did you know that something as routine as your daily shower could be silently pushing you toward a heart attack or stroke? I know that sounds dramatic, but stay with me because what I'm about to share could save your life. Every year, thousands of adults over 60 experience serious cardiac events during or right after showering. Here's what makes this terrifying. Most of these people felt perfectly fine just moments before. No chest pain, no warning signs, just a normal morning routine that suddenly turned into an emergency. After more than 2 decades in medicine, I've seen this pattern repeat itself far too often. But here's the part that should give you hope. According to cardiovascular research, up to 80% of these incidents are completely preventable. The problem isn't your heart, it's your habits. In the next few minutes, I'm going to walk you through exactly which shower habits are putting your life at risk and show you the simple changes that can protect your heart and brain starting today. Let me explain something most doctors never take the time to make clear. After age 60, your cardiovascular system becomes dramatically more sensitive to sudden stress. Your heart doesn't respond as quickly as it once did. Your blood vessels have lost elasticity. Your blood pressure swings more unpredictably. And the shower is one of the few places where multiple extreme changes hit your body all at once. Heat, steam, standing upright, rapid blood redistribution. For a younger person, this is manageable. For an aging heart, it creates what I call the cascade effect. Here's how that cascade works. Maybe you've noticed this yourself. You step into a hot shower. Within seconds, your skin flushes red. Steam fills the bathroom. You feel relaxed, almost sleepy. That's not relaxation. That's your blood vessels suddenly dilating, opening wide all at once. When that happens, your blood pressure drops rapidly. Your brain detects this drop and immediately sends an alarm signal to your heart. Pump harder. Pump faster. Your heart rate can jump by 30 or even 40 beats per minute within just 2 minutes. Now, for an older heart, one that's accumulated decades of wear, maybe some plaque buildup you don't even know about, that sudden demand is like forcing an old engine to run at maximum speed without warming up. Something is going to give. This stress can trigger dangerous heart rhythm problems, reduce oxygen supply to your heart muscle, or create a sharp spike in brain pressure that sets the stage for a stroke. A long-term study following thousands of older adults found that those with certain shower habits were more than 3 times as likely to experience a serious cardiovascular event. And almost none of them had been warned. Let me tell you about the first and most dangerous habit, showering with very hot water. When I say very hot, I mean water above 40 degrees Celsius, the kind that produces thick steam, the kind that feels therapeutic. In reality, it can be deadly. In my practice, I treated a 71-year-old man who loved long, steaming hot showers. He said they helped him unwind. One morning, after his usual routine, he felt tightness in his chest, but brushed it off. 2 hours later, he was in the emergency room with a major heart attack. His cardiologist was direct. The shower triggered it. Researchers analyzing sudden bathroom-related deaths found that the majority occurred during showers with very hot water. The combination of heat and steam also reduces oxygen levels in the small bathroom space, forcing your heart to work even harder just to supply your body with what it needs. Medical guidelines now recommend that adults over 60 keep shower water between 35 and 38 degrees Celsius. Here's a simple rule. If your skin turns intensely red, if the bathroom fills with heavy steam, or if your breathing feels uncomfortable, the water is too hot. Adjusting this one habit removes one of the most dangerous hidden risks from your daily routine. But hot water isn't the only problem. Stay with me because what I'm about to tell you next might surprise you. The second deadly habit is something many people actually believe is healthy. Sudden temperature changes. Switching from hot to cold water or finishing your shower with a blast of cold water to boost circulation. For an older adult, this is like delivering an electric shock directly to your heart. When your body is suddenly exposed to cold after heat, your blood vessels clamp down violently. Blood pressure can spike within seconds. At the same time, your body releases a surge of adrenaline. Your heart rate accelerates sharply. This combination massively increases the risk of dangerous heart rhythm disturbances and hemorrhagic stroke. Studies on adults over 65 have shown that abrupt temperature changes dramatically raise the risk of irregular heartbeats. I remember a 68-year-old woman who tried finishing her shower with cold water after seeing it recommended online. The moment the cold water hit her back, she felt crushing chest pressure and severe dizziness. She survived only because help arrived quickly. Her doctor told her plainly. She was seconds away from a heart attack. If you ever need to adjust temperature, it must be gradual, about 1 or 2 degrees per minute. But for most older adults, the safest rule is simple. Maintain a stable, warm temperature throughout your entire shower. Do not experiment with your cardiovascular system. Now here's where people get confused. The third deadly habit is staying under the water for too long. Many older adults enjoy showers lasting 15, 20, even 30 minutes. They feel relaxing. But every extra minute adds cumulative stress to your heart. Prolonged exposure to warm water causes gradual dehydration. You lose fluids and electrolytes without realizing it. Your blood becomes slightly thicker, which increases the risk of clot formation. A clot in the heart causes a heart attack. A clot traveling to the brain causes a stroke. Standing for long periods under warm water also causes blood to pool in your legs because of vessel dilation. This reduces blood flow to your brain and explains why so many people feel lightheaded or faint in the shower. Research has shown that showers longer than 10 minutes dramatically increase the risk of fainting and dangerous falls in older adults. But here's the most critical detail. The most dangerous moment isn't during the shower. It's immediately after stepping out. That's when your body must rapidly adjust, and dehydrated blood struggles to circulate efficiently. The majority of shower-related cardiac events happen within the first few minutes after exiting. A 74-year-old patient of mine loved long morning showers. One day, as he stepped out, he became dizzy and collapsed. He suffered a stroke. The long shower had dehydrated him, thickened his blood, and the sudden pressure change when he stood allowed a clot to reach his brain. For adults over 60, medical experts recommend keeping showers to 5 minutes with an absolute maximum of 7 minutes. That's enough time for hygiene without accumulating dangerous cardiovascular stress. If you need more time, sitting on a shower chair significantly reduces risk. Now, before we continue, let me tell you something important. The fourth deadly habit has nothing to do with water temperature. It's when you shower. Specifically, showering on an empty stomach or showering right after a meal. Both can put your heart under extreme stress. When you wake up, your blood sugar may be low. Your body is still transitioning from sleep. If you step into a warm shower, your blood vessels widen and blood pressure drops. Combine that with low blood sugar, and your brain may not receive enough oxygen and energy. That's when you get warning signs people ignore. Feeling lightheaded, feeling weak, vision going dark for a second. And then, in one moment, you lose balance on a wet floor. One patient told me she always showered first thing because it woke her up. One morning, 3 minutes into her shower, everything spun. She tried to step out quickly, slipped, hit her head, and ended up in the emergency room. Her blood glucose was low. Her blood pressure had dropped. The shower didn't wake her up. It drained the last bit of stability her body had. Now let's talk about the other timing mistake. Showering right after eating. After a meal, especially a heavy one, your body sends blood to your digestive system. If you then shower, warm water shifts blood flow away from where it's needed. Your heart is forced to manage two competing demands. Digestion needs blood. Heat exposure shifts blood and pressure. For an older heart, that overload can be the breaking point. So here's the safe timing rule. Never shower on a completely empty stomach. Never shower within the first hour after a heavy meal. Best time in the morning is 30 to 60 minutes after a light breakfast. If showering later in the day, wait at least 2 hours after lunch or dinner. That alone removes a massive amount of risk. Now we come to the fifth deadly habit. This is the one that causes the most tragedies because it happens after the shower when people think the danger is over. Standing up too fast and not hydrating before and after. After a shower, even a safe one, your cardiovascular system is still adjusting. Your blood pressure may be lower than normal. If you stand up quickly, bend down, twist, or rush, your brain can briefly lose blood flow. This is called orthostatic hypotension, a sudden drop in blood pressure when you change position. In younger people, the body corrects this instantly. In older adults, that correction is slower. You can spend 10 to 15 seconds in a danger zone, and that's enough time for a fainting episode and a life-changing fall. Here's what makes it worse: dehydration. Many older adults don't drink enough water. The sensation of thirst decreases with age, but dehydration makes blood thicker and circulation weaker. Add a warm shower and more fluid loss through heat, and you step out with even less circulating volume. That increases clot formation risk and makes dizziness far more likely. So here's the hydration rule. Drink a full glass of water 15 to 20 minutes before your shower. Drink another full glass after you're dressed and stable. Now I'm going to give you the complete safe shower protocol, the same kind of routine taught in senior safety programs. Because knowing the dangers isn't enough. You need a simple system that protects you every single time. Step 1. Before the shower, take 3 minutes to prepare. Check your timing. If it's morning, eat something light first. If it's later, make sure it's been 2 hours since a full meal. Hydrate. Drink 1 full glass of water 15 to 20 minutes before showering. Prepare your environment. Towel within reach, clothes ready, non-slip mat in place. If you have any balance issues, use a shower chair. Use the bathroom first so you don't have to rush mid-shower. Step 2. During the shower, keep it to 5 minutes total. Set your water temperature to warm, not hot, about 35 to 38 degrees. If there's heavy steam or your skin turns bright red, it's too hot. Enter gradually. Wet your feet and legs first, then arms, then torso. Take 30 to 45 seconds to let your body adapt. Keep it short. 5 minutes is ideal. Maximum 7 minutes. Listen to warning signs. If you feel dizzy, weak, nauseous, or short of breath, sit down immediately. Don't push through it. In the last 30 seconds, slightly lower the temperature. Not cold, just slightly less warm. Then turn off the water and stand still inside the shower for 30 seconds before stepping out. Step 3. After the shower, this is where most accidents happen. Exit slowly with one hand on the wall or a stable surface. Sit down immediately on a chair, bench, or closed toilet lid. Dry yourself while seated. Start with feet and legs, then body, then head. No rushing. Dress while seated. Underwear, shirt, pants, all while sitting. Stand up in 3 stages. First, move your legs up and down 10 times to wake up circulation. Then scoot to the edge of your seat and wait 5 seconds. Finally, stand up slowly while holding support. Wait another 5 seconds before walking. Once you're fully stable and dressed, drink another glass of water. That's it. Simple, repeatable, and powerful. You don't need to live in fear. You just need awareness and a plan. Your shower doesn't have to be a danger zone. It can be safe, relaxing, and refreshing if you respect what happens inside your body after 60. Let me give you one more thing. If you take blood pressure medications, have heart disease, diabetes, uncontrolled high blood pressure, or experience frequent dizziness, talk to your doctor about the safest shower routine for you. Some people may need even shorter showers or specific adjustments based on their medications. The goal at 60, 70, or 80 isn't just to live longer. It's to live better, with independence, with dignity, with confidence in your daily routines. Start small. Commit to one change today. Lower your water temperature, shorten your shower time, hydrate before and after. Each small adjustment reduces your risk dramatically. If this was helpful, hit that subscribe button because I share simple, practical health guidance that helps you stay strong, independent, and safe as you age. And please share this with someone you care about, a parent, a grandparent, a neighbor, because if they shower the old way even one more time, they may be taking a risk they don't even know exists. Thanks for watching. I'm Dr. Mark Westfield, and I'll see you in the next one.